Friends, let's have a very quick look, an unbiased and impartial look at the corona management, whether you call it as management or mismanagement, both at the center and the states. So these are the views of the experts, both national and international also. See, India, no doubt, it was one of the best countries in the world to handle the corona first wave of pandemic. The country and the states now seem to be in a highly confused state in the second wave. In the first wave, there were many shortcomings. However, those are tolerable in view of the vastness of the country, its severe population size, and lack of experience. In the second wave, one expected the country and our states to manage far better as they have enough experiences from the first wave. COVID-19, the coronavirus situation in India is marked by lack of beds, lack of oxygen cylinders, lack of medicine, lack of vaccine. And the parameters in our model for the current phase in the second wave, they are continuously changing, they are continuously drifting. We are in a critical and confused state. Even the courts also started issuing directions to both the center and the state governments. On one hand, government says they are confident of vaccinating all adults by December end with estimated supply of around 180 to 190 crore doses. But there are many missing linkages and variables in this statement. See, the India's corona control measures. Number one, the lack of general but essential facilities. Lack of hospital beds, lack of testing facilities, testing results taking long time, the lack of ICUs, the lack of oxygen, lack of ventilators, the life-saving medicines, less cremation grounds, the patients dying without doctor's attendance, also non-availability of the medical staff, etc., etc. So all these are shown in various national live TV journals, write-ups, etc., etc. So the state or central governments or the administrators, the bureaucrats, they cannot also hide these. So what we are trying to emphasize is that we learned nothing even in these small but important things from the first wave. There is inability to time for the timely grasp of the second wave. See, daily increase of the corona positive cases, they are the hallmark of monitoring. India's gradual decline is started from November last year and reached its peak on 10th March this year with less than 20,000 cases. But the gradual increase of the ascent starts from 11th March with more than 20,000. Then with the double fold increase to more than 40,000 in another 10 days on March 20th this year. And in another 1 week, there was a threefold increase with more than 60,000 cases daily. Again, in another 1 week, 4 to 5-fold increase in the range of 80,000 to 1 lakh, it was seen. So the subsequent rise of more than 1 lakh since 5th April and touching a 7-fold increase and 8-fold increase after 10th April with around 1.5 lakh cases and the magic 10-fold increase figure of more than 2 lakh cases on 15th April and continuing to do so. So by mid-March, proper treatment should have been advised and administered accordingly, both by the states and the center, instead of focusing on the elections, mobilizing lakhs and lakhs of people. However, there is a blame going on. Indians would like all political parties, the politicians, to unite together and fight this menace on a war footing basis. Definitely, there is a gap between the demand and supply of vaccine doses. When two vaccines were approved in January this year, 2021, we found miscalculations of the required vaccine dose. Covaxin and Covishield companies should have been given a timeline for a clear production target based on this sound management technique, based on sound calculations. This was not so and is still not happening. Now there is a tussle between the states and the center regarding the less supply and adequate supply, openly blaming each other. The gap in vaccine choice also is there. When less populous states, means countries like the USA and the UK, etc., have demanded from the approved companies the huge vaccine doses, indicating their timeline target of vaccination, we are just left far behind in this field. Of course, our first and second targets, they are reasonable and they were really worth price. But once we saw the target fall, the country should have gone for universal immunization with vaccine choice. That is Covaxin or Covishield, J&J, the Sputnik 5, etc., etc. But anyway, even if it is late, it is good that Sputnik 5 or Sputnik V or whatever you call is already approved and the J&J is on the pipeline for import. Vaccine coverage in terms of population percentage. So in terms of total population covered who received all doses prescribed by the vaccination protocol, as of April end, India is in the 18th position among the world countries with less than 1.2% compared to 24% of USA, 13% of UK and 4% of Russia. So in terms of population who had received at least one dose, India has covered 7% of the population as of April end, or say mid-April, when compared to 48% of UK, 38% of USA, and 20% of Germany and 5% of Russia. And of course, the US expects to cover 80 to 90% by July end of this year. So, however, in terms of vaccine load administered, India is the third. It is on third position with 120 million next to China and US. Our corona managers should become active. They should work on war footing basis, at least now stopping criticizing others. So the actual population covered either by total dose or by single dose, it is the most sensitive variable. And that of course, God only knows how long the country will take to cover 70% of the population to have a community immunity. And coming to both the positive and the negative sides of the issue, of late, India has enhanced its vaccination population by around 20 to 40 lakhs per day beginning from April. So it's a good indicator indeed. Luckily and surprisingly, people have started rushing to vaccination centers after the second wave because of the fear, psychosis. However, testing remains static with around 11 to 15 lakh per day in spite of Prime Minister's call to enhance it, especially by the RT or PCR test. So it indicates more hidden and asymptomatic cases, thereby spreading more and more. The benefits are far more compared to the side effects of the vaccine. And if the data of the side effects, including the death cases, if it is shared region-wise, country-wise, this will definitely enable the people to have the vaccine choice and subsequently enhance the vaccination process and the lingering doubts be cleared once for all. And there is also inability on the part of various specialist associations. See, the inability of various specialist associations to crystallize the independent opinions in critical areas, various doctors, associations like public health, the hospital administration, the microbiology, virology, They have completely failed to crystallize and come to an independent opinion in critical areas, and they have utterly failed to influence the government's decision-making process. So why blame only the bureaucrats? So in the given scenario, the action points should be like this. For the present second wave, mass severe action should be taken both at the center and the states. It applies to both bureaucrats, doctors, regulators alike. And though some of the advisory teams at the states and the center, they have done immense praiseworthy works. The nation's loss is far above the gain. Otherwise, India would not have been in such a mess. The only objective of the government should be to vaccinate as many as possible. For that, give vaccine choice, open vaccination to all above 18. Open 24/7 the services where facilities are available. And the four vaccine choices should be given with reasons. In fact, this is our fundamental right. And coming to short-term objectives, declare the 14-day lockdown in a corona hotspot, cities, towns, localities. In short, it is nothing but declaring the quarantine zone and doing SOP. So by this, I mean total survey, total testing, appropriate treatment at appropriate place, and proper preventive measures, the so-called trace, test, treat, and SOP. So by this alone, we can save another country lockdown. At present, only 2 or 3 states or places are having total lockdown, shutdown, because they could not do it in time in mid-March because of our election busy, etc. So the virus had already spread to many states and will continue to spread. It is in front of our eyes. One can easily see it. So this is also the only means to prevent the total country lockdown. So this is only again a feedback, and it is not a criticism. So as to replan the whole national corona control program, and these are the views of the experts in the field. So thank you, friends. Thank you.